So today I'm with Dr. Gregory Gumberich, who practices upper cervical alignment, and I'd just like to get him to explain to you exactly what it is that he does, because I've been to osteopaths, I've been to chiropractors, I've been to body workers of all sorts, and although they make you better, they don't make you completely perfect. And I literally just had one session with Dr. Gumberich, and my head feels like it's floating perfectly balanced on my body, and I've never experienced anything like it. So I'd just like him to talk us all through what it is that he does that's so different from every other therapy that I have tried. So,
okay, well, thanks so much, Sarah, for the opportunity to explain this procedure. We're using a procedure called NUCCA, N-U-C-C-A. It's an acronym for the National Upper Cervical Chiropractic Association. We're also using orthospinalogy. Orthospinalogy is an upper cervical technique like NUCCA, only we use an instrument rather than just our hands, which is what's done with NUCCA. NUCCA's hand by hand, orthospinalogy's with an instrument, or it could be done with hand too. So we'll get started by saying that the upper cervical complex is made up of the skull, the atlas, C1, and C2, the axis. Atlas turns on axis. I have a little model here. It's a supersized model to show this is the skull, and this is a cutaway of the skull that sits on top of the atlas, and then we have the axis, the C2 vertebra, that has an odontoid process that the atlas turns on. And when we watch that turn like that, we can see all the head, when we turn our head to the right or to the left, all the head rotation occurs between atlas and axis, C1, C2. If atlas goes out of alignment and it comes out of its little indentations called the facets, it's going to take an external force to put that atlas back into its facets. And once that's accomplished, everything below this area here, the upper cervical area, will line itself up. There's no need to adjust a low back if the problem is up here at the level of the axis and atlas. So we're going to look at atlas and axis and skull, make sure they're aligned, and check the patient periodically to make sure that they're holding their adjustment, and then we just leave them alone. That will take any pressure off the brain stem that passes through this opening here. And the brain stem is the stalk of nerves that there's a fiber that will innervate every cell of the body. So we want to make sure there's no pressure up at this very important neurological complex. When we get this done, most patients like Sarah will mention that their head feels lighter on their shoulders. And then it's usually a couple of days after that they'll start feeling symptoms start to ease up, and we know they're on their way to a recovery.
But I have to say that my symptoms cleared instantaneously. Literally, as I got off the couch, I could just feel it had all gone back wherever it was meant to be.
It's quite amazing. I mean, you know, we see patients with all walks, all types of problems, from all walks, I should say, and they're going to benefit if their problems are atlas and axis related. If the atlas is causing the problem and we correct it, they're going to feel better. And most of the times they'll have full remission from the symptoms that they have.
And can you just explain about, I think one of the things that's really different is that Dr. Gumberich takes x-rays of your head, and it's a very mathematical process,
yes.
Isn't it?
What we do is we take three pictures, a nasium, a lateral, and a vertex. Now the vertex tells us if there's any rotation of the atlas. That's the overhead picture. The side picture tells us if we lost the curve in our neck, and if the atlas is either superior or inferior. And the nasium, straight back behind the nose the atlas sits, it tells us if the atlas has any laterality, tipping side to side. And those three combinations can add up to a multitude of different misalignments. So we just can't do this without taking these pictures. It's very important. We use digital equipment. The pictures are very fast, so there's very minimal radiation that the patient's exposed to. And the good always exceeds that amount of radiation when we realign that atlas and get it to hold.
And then the very fascinating thing to me was that, I've been crunched and scrunched and all sorts of things have happened to me from chiropractors and osteopaths. But here, you literally just lie on the couch, and there's a very strange machine that basically just is put in exactly the right position because of understanding the X-rays.
Of those X-rays, right.
And then it's literally like someone puts their finger and just very gently goes like that once or twice. And that's it. And you get up and you are a different person. And I'm just so incredibly overwhelmed by the whole thing.
I couldn't have said it better myself. It's the vector. We're trying to find the proper vectors for moving the atlas, and we get that from the images. So if there's any questions that you might have, you can contact Sarah or myself. My email is ggumberich, that's ggumberich @yahoo.com, and we'd be more than happy to answer any questions that you have. Thank you very much.
Thank you very much.
Appreciate
indeed.
it.
Yeah, it's great. Thank you.